Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the best way to study the Z codes. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so probably one of the number one specific things about coding that I get question-wise is about the Z codes. Everybody says, well, Blue, I don't know when I'm supposed to apply it and what I'm supposed to do with them, and I hope I don't forget them and that kind of thing. That, and of course, evaluation and management, which everybody thinks is scary, but is not. Here's the thing with the Z codes. They cover a lot of things. They cover encounter for, they cover the details, they cover the history, personal and family history. So it covers a lot of things. And how do we learn them? What is the best way? We're going to play with the book today. Aren't you excited? I'm excited. All right, so even if you don't have an Optum book, it's the same thing if you have the AMA ICD-10-CM book or the AAPC ICD-10-CM book. It doesn't matter. What I want you to do is I want you to go all the way to the back of the book, and I want you to open up to the section for the Z codes, okay? And that's where we're going to start today's video at. Now, I will say this about Optum. This is not an ad, okay? Always not an ad. But I love Optum. And Optum has the best tools for medical coders as far as I'm concerned. Why? Because it comes out with things like this. There's no other publisher that does this that I have seen personally. So before the beginning of every single chapter, they have the chapter-specific guidelines, okay? And then the best part is they have examples. They have a question, they have the answer, and then they have the rationale. I know you can't really see it, and I mean, I could creep forward a little bit, but the whole purpose is this. If you have an Optum book, the best thing that you can do, one of the best things to do to start learning, is to cover up these answers and look up the question yourself. Try to start doing things that will force you to use the book. Now, I know every time, like, people will talk about, oh, but I didn't learn that in my school, and in the school it was all multiple choice. Well, I'm telling you now that you can cover up these answers and start looking up each one of these. And so look up these. There's 3 on the first page, right? And then you flip, and there's more, because the Z codes in this chapter, chapter 21, are quite long. See, there's all of this information. So there's all of these little scenarios that you can work through, okay? And that's the first thing that you should do. But you should also be reading the chapter guidelines for the Z codes. Now, if you watched my video on Monday, because that's when I'm going to air it, on Monday, about how to study the ICD-10-CM coding guidelines, I said that you should read the Z codes by themselves. That should be 1 day's worth of reading, because it's so long and it's so much, okay? So I want you guys to not be overwhelmed with the information and be able to take it all in. And the best way to do that is to just kind of focus on the Z code, especially chapter 21 by itself, reading it by itself. But that's the first thing you should do if you have the Optum book, is cover up these answers and try and see if you can get the answers yourself by looking them up with just this scenario question here, okay? But if you're wondering, okay, but how do I know what codes there are and what do I look up first? So the first thing, again, that I want you to do is read those coding guidelines first. And you should be reading the Z code guidelines along with the rest of the guidelines once per week, okay? Now, for this part here in learning the Z codes, what I want you to do is take a Saturday, take an evening, any time that you have time. And what I want you to do is I want you to literally look at every single page the Z codes have to offer. And it's not that big. It's not that big. This is not a big chapter, not like the injury chapter and then the musculoskeletal system chapter. Those are quite big. But with the Z codes, what you need to do is you need to expose your brain and your mind to what is actually out there. Because again, the Z codes cover a lot. Z codes cover why a person would be encountering healthcare, like for a preoperative exam, right? Or if they're there because they're a kid and they're going to get the sports physical done. There's also a code for that. And if a person has had a hip replacement, there's a code for that. So there's a lot of things that you can learn about just by looking at the chapter and exposing your mind. Okay, there's a code for that. Because while I'm not asking any of you to memorize everything, what I want you to do is give your mind that exposure, because you're going in cold, right? You haven't been a medical coder before. A lot of you don't have experience in the medical field even to begin with. So the best thing to do is to learn about what's actually out there, and sitting for a Saturday and just looking at what's there. What kind of codes do they have? Do they have a code for that? That's going to be your best bet. Now, yes, there's the index, but what I want you to do is focus on the tabular section, because this is where all the answers are at. We'll get to the index in another video, all right? Because that's another video all unto itself. But what I want you to do is look at what the chapters are about, right? So we have the first section here of this chapter where it talks about persons encountering health services for examinations, and it gives you Z00 to Z13. So then it starts breaking down all of the codes that are here, and it says encounter for general examination without complaint, suspected or reported diagnosis. And then it breaks it down. It's telling you that this code is not complete, that it needs to have another digit. So that's why that little checkbox is there, okay? And it says encounter for general adult medical examination. So it talks about the excludes one note, and then it says Z00.00, encounter for general adult medical examination without abnormal findings. And then it's this one right underneath it is Z00.01, encounter for general adult examination with abnormal findings. And I want you to look at this also here, okay? Pay attention to this. As you're going through the book, you're going to see notes like this. It says use additional code to identify abnormal findings. Whenever you see use additional, that means that this code is going to go first, and then you're going to use another code to identify whatever. And so in this case, it's to identify abnormal findings. So that's what you're going to code next. So a good thing about putting the Z codes in your mind is that it's going to help you to recognize, okay, I remember something about that. Oh yeah, not only do I code this, but I also code something else, okay? And then I want to point this out too, because a lot of people ask me about this too. What is AHA colon 2016 1Q 35 to 36? So for ICD-10-CM, the people that manage this book, the editors and everybody, the committee that manages these books, will get questions about coding, because not every single code is as specific as we would like it to be. And sometimes in some of these situations, there is a conflict. And so people will write in these unusual questions, and the editors of ICD-10-CM and the committee will answer these questions. And so what this is saying, what AHA is the American Hospital Association. In 2016, they call them coding clinics, right? Whenever somebody writes in and they are asking a question, it's called a coding clinic, okay? So this says that there's an AHA coding clinic in 2016 in the first quarter on page 36. And then this one is, there's an AHA coding clinic 2016 first quarter, page 35 through 36. So that means that you can look up whatever the question was that they were asking about if you have access to a coding clinic. And so that way you can look that up. You can subscribe to Coding Clinic, but it's a little bit more costly, and a lot of times it's part of the encoder package anyway, if you are working at a facility that has an encoder package. And so you just have to look around in the system in order to find it. And like I said, you can subscribe to it if you like, but a lot of times where you're working, they'll already have it. So just make sure that you're looking at that and you're not spending money willy-nilly, okay? But that's what that means. So you don't have to look it up. It's just in case you feel like you have a question about that, using that specific code, okay? So you're just going to keep looking at all of these pages, and you're going to look at all of these things, what all codes that they have here. Encounter for examination of eyes and vision. So if you're working for ophthalmology, that's probably a code you would want to know about. And so there's all these other codes here, and you're just going to keep going. And again, it's going to give you directions on how to pick up additional codes. Okay, and then the index is not going to give you those directions, but the tabular section will. That's why we always go back to the tabular section. You'll hear anybody that's teaching coding say that, hey, you have to look up your code in the index and then you come back to the tabular to try to find the answer. And it's because there's often directions back here telling you a little bit more, okay? Obviously that couldn't fit in the index. But again, you're just going to keep going through. And the great thing about Optum, okay? Now, again, other publishers may do other special things. But what I like about Optum is that they provide tips throughout, okay? So they will have little tips throughout here while you're reading and looking at the section. Again, you don't have to look at and read everything, but like these little tips, they stand out. And so just taking the time to just kind of look that over and kind of have it in your head, that way this is getting you more familiar with what is out there and what you are supposed to be doing, okay? So you're just looking through and you're looking at all the things that are available here, all of the examinations for, and all of these things, because the doctor is not always going to write things the way that it's in the book. So we have to learn to interpret appropriately. And knowing that there's a code for a certain thing, and knowing that, hey, we got to pick this up as well, that's going to come with time and practice. But this is the best way to start. Again, going through and just looking at all of these, and it will help you to get familiar with, hey, yes, there's a code for that, okay? And there's a lot of this code also, if applicable. You'll see those notes throughout. Related disorders, and it'll give you a whole list of things that if it's applicable, if it's documented, then we want to make sure that we're paying attention and adding those things, because we may not have known, right, to pick up certain other things, or do we have to pick that up as well, and that kind of thing. If you're following the book will help you, all right? The book will help you. But again, the only way to do that is to expose your brain to all the things that are back here. And a lot of people don't do that. They get stuck up in the index part and they don't come back to the tabular section. One of the things that I like to do when I'm studying, if I have to look at a book and I'm reading a chapter, what I'll do is I'll go to the end of the chapter and I'll look up the questions. I'll look at the questions, I'll just read them, and then I'll start to read into the chapter, right? And so even though I'm not going to remember every single question that it's asking me, my brain has already had exposure to the potential questions that are going to be asked. Well, maybe there's one or two words that stand out. And so when I see those as I'm reading, I'm going to know, hey, I got to really pay attention to this part. This is the same sort of thing that you're doing when you're exposing your brain as a coder to these Z codes. And you're just going to keep going through, because you're going to be like, okay, yes, I know that there's a code for that. There's a Z code for that, or there's a history code for that. Not really thinking about how did you get here, but rather that you did it because you've been studying and you've been practicing with your book. The book is not anything to be afraid of. A lot of people will say, well, Blue, the book is so big and there's all these things in there. Take some time. Sit with it. Look at this. So a lot of times when people are coding for mother baby, I will see a lot of coders forget to put the weeks of gestation. And that's all right here. Again, if you had known that there was a code for that, you wouldn't have forgotten it, right? You would have remembered that the Z codes are telling us encounter for It is telling us a little bit more about the story. It's giving us a little bit more background about the patient, history-wise, family history-wise. And that's what you do. And that's how you study that. Okay, so again, and then making note of those little special notes and things. So that way you can be like, oh, okay, yes, I know that there's something about that, right? And it's telling you to, in this instance, to assign an additional code for associated condition if that condition requires, constant intervention from the device, as in the cause of sick sinus syndrome. So again, a lot of really good information there. Okay, so that's what you're going to do. That's one of the first parts you got to do. And I know that this video is really more specifically about the Optum book, because there's another feature I want to show you guys. But again, you can do this if you have an AMA, AAPC, ICD-10-CM. You're just looking at what codes are available. Okay, you've got to look at what codes are available, because the more that you do that, oh, okay, I have it in my mind. I have it in my head. Okay, look, there's codes for transportation insecurity. There's codes for financial insecurity. There's codes for material hardship due to financial resources not elsewhere classified. It talks about what all these things mean and what all is covered in these. So, again, how are you going to learn? How are you going to learn? For those of you who are coding for behavioral health, you think that these things are important to know? Absolutely. Absolutely. Because, there's a lot of people that think, oh, well, I just need to pick up the diagnosis code. But what if there's these other things like transportation insecurity and financial insecurity and all of these other insecurities, and then, of course, housing instability, housed, and then they have unhoused, that kind of thing here. So what they do with these Z codes when they're being picked up appropriately, right? When coders understand and know when to pick them up, because it's affecting the provider's ability to be able to care for the patient, or it is impacting their thought process and how they're going to handle their situation. When these codes are being picked up and they're able to be put into a, what is the word I'm looking for? Like a spreadsheet. And they can make all kinds of graphs and charts and stuff like that for it. And they can figure out, hey, in this area, we have a high population of folks who have financial insecurity. Why don't we come up with some programs to educate people about being more financially secure and what things that they can do to help them manage their money? Or what about if they have transportation insecurity? Okay, well, in this area, then that means maybe we need to have a bus system. Maybe we need to have some sort of other transportation so that people can get around, because it's obviously affecting them. These are things that we use as like people who are doing the data collection, that the codes that are being selected, these data people that are analyzing all of this stuff, this is the information they can glean out of all of that. And because they can, we have done our job. We have done our job because this is what the patient is coming in, and we are translating this appropriately. So again, make sure that you know if there is a code for this. And if there is, and it does apply to this situation that you're coding for, then you need to pick it up. The fact that you say, well, I didn't know that, that's not an excuse, okay? This is the best way you can avoid saying that. Well, I didn't know. Well, I'm new, I didn't know. No one's going to care that you're new. They're not. They're going to expect you to be competent already. And I'm telling you, this is how you become competent, okay? We have our BMI here. We have all of these other Encounter 4s here, Encounter for Health Services. And there's more here. And then we have persons with potential health hazards related to family and personal history, and certain conditions influencing health status. And we have there's Z77 to Z99. So here's all of these, right? And there's all of these things here. And this is all you have to do, guys. And just to look and see, what all is out there. That's all you have to do, is just to look and see what all is out there. And it's giving you the directions. It is telling you, use additional code. This one here, it says code first any follow-up examination after treatment, Z09. So it's telling you right here, is giving you a sequencing direction right here. Z09, which is a follow-up after completed treatment for non-malignant condition. So here's all of these other ones. Personal history of diseases of the respiratory system, right? And then it says conditions classifiable to J00 to J99. I want you guys to pay attention to that. Why? Because if you're new, it is difficult to know what falls under what, right? And even though it may be clear as day to somebody else, it's not always clear to other people. So right here, if you look, it's telling you if it's a personal history of a respiratory system, then that means think about what diagnosis code it was, and if it is completely resolved and they're not treating it anymore, and it was in this J series, J00 to J99, we know that's in the respiratory system. So we know that that would be appropriate, right? Whatever one it is, either history of pneumonia, recurrent, or personal history of other diseases of the respiratory system. So if it's not pneumonia, it's something else, maybe it's bronchitis or something, then you want to go ahead and pick that up, right? So that's how you know. And then it goes again here, digestive system, conditions classifiable to K00 to K93. So we know that any codes that fall under this, the K00 to K93, we know that that's all digestive system. This is what you learn going through the book. This is what you learn going through the book, y'all. That's what I keep trying to tell y'all. Look here. Another one. Personal history of diseases of the skin and subcutaneous tissue, right? L00 to L99. Again, you may be thinking that this may be, so simple to think about. But no. When you look at these, okay, wait a second here. Now I see. Musculoskeletal system, M00 to M99. That's all the musculoskeletal system. We know that, right? But here's some more specified ones, right? It says here, personal history of healed non-traumatic fracture. So be careful, because there's history of injuries and trauma and fractures. Those are separate from this. Musculoskeletal is when the patient is having something organically wrong with their bones, right? A non-traumatic fracture, which it is possible to have a non-traumatic fracture, all right? So that's what they're doing here. And then personal history of healed osteoporosis fracture. And it gives you a tip here. So that's the things that you need to know there. And here we go. And it keeps going. Same thing with the GU system. It's right there. Okay. So there's all these things. Oops. Let me pull back a little bit. But those are the things that you learn by looking at the actual codes that are available. Okay. Look at that. So there's things that you're going to know to pick up because you've been doing this. You see? And all you have to do is just take the time to look at the codes. You don't have to read everything, but just look and see what's available back here. And you see, me running my mouth for 24 minutes already, we were able to flip through all of that. Okay? So that's what you need to do. That's the thing number 2 that you need to be doing. Okay? The other part is this. Okay. Now I know if you do not have an Optum book, you probably will not have this. But this appendix back here is saying Appendix D is the Z codes only as principal or first listed diagnosis. I've talked about this section before, this is not all inclusive, because all of these Z codes here, there's still other Z codes that could be first listed, okay? But these are all the ones that they have here on this list as principal or first listed diagnosis. What I also recommend that you do is you take the time to look up each and every single one of these diagnosis codes to see what it is. Again, we want to put that into our brain so that we know what's available and what's out there. And all you have to do is just practice on that part, guys. That's all you have to do, is just practice on that part. And when you do that, when you're spending time with the book, that's when you get to know the book. The book is not so overwhelming to you, because that's what I hear. And you know, that's my personal pet peeve word, overwhelm. Because I feel like if you're overwhelmed, it's because you're trying to do too much of something, or you're looking at it too closely. Did you see one bit of writing in here? No, you did not. Did you see one, do you see this book being tabbed? Heck no, it's not tabbed. Why? Because I use my book regularly. I use my book on a daily basis. This book does not have a stitch of writing in it. Yes, it does have those things, because I was showing this on a video, right? But what I wanted to do was to show you guys how to cover up the answers, so that way you can get your practice in. You can look at the question, look up the codes, and then find what your answer is. And just setting it up something like that. So that way you can get that practice in. The only way that you're ever going to learn is by practicing. There's no amount of money that you can spend, no boot camp classes, nothing that you can't do yourself with this book. But I'm telling you, read your Z code guidelines, look at all of the codes that are available for Z codes, and then if you have the Optum book, look up all of those first listed principal Z codes, so that way you know what code that is, or what's available out there. Because again, coming in with no knowledge, I get it, because I was there. But as somebody who's been in this for 17 years, I can tell you that what I'm telling you now, I wish somebody would have told me. Because I was like you, I didn't know when do Z codes get picked up? When do I pick that up? If I had known to just look back there, look at what's available, my life would have been a lot easier. So I'm trying to make y'all's life easier. But anyway, that's my episode for today. But that's the best way to learn the Z codes, okay? It's not about anything else other than spending time with your book. Don't be writing in it, tabbing it, highlighting in it, because those are it's, you guys know how I feel about it. And to me, everybody learns differently. And there's always going to be somebody crying and whining and saying, oh, but no, that's how I learn. No, you don't know how you learn when it comes to this. I'm the one who's a coder, and I'm trying to help you to learn. That's how you learn, is by actually looking at it. Don't waste your time highlighting and writing, because when you get into that exam room, guess what's going to happen? You are not going to have time to be reading your notes. You're not going to understand what the heck you meant when you're highlighting all this stuff. That time is already wasted and gone. And I'm trying to keep y'all from wasting any more time. Get in this book and start looking at it. Get into that Z code section back there and look and discover those things. So that way it can make much more sense to you. At least that's just my advice anyway. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.